Thank you for joining Understanding HIPAA Compliance Technical Security. We will be starting shortly. We will wait a few more moments for others to join us. Thank you for joining Understanding HIPAA Compliance Technical Security. We will be starting shortly. We will wait one more minute for others to join us. Thank you for joining the BioMedix webinar, Understanding HIPAA Compliance, Technical Security. My name is Melody Vistam, Marketing Coordinator at BioMedix, the sponsor of this webinar. Our speaker today is Dr. Michael Brody. Dr. Michael Brody is a nationally recognized speaker presenting on health information technologies and electronic health records. He is a featured health information technologies writer for Podiatry Management Magazine, APMA News, and the PICA newsletter. Dr. Brody received his DPM at the New York College of Podiatric Medicine, is involved in resident education at VAMC Northport, and has been in private practice for over 20 years. We have 3 housekeeping notes. If you have questions, please type them in the question box to your right. We will have time at the end of the webinar to answer some of your questions. There will be a survey questions at the close of the webinar. Please take the time to answer them. We appreciate your feedback, and it will help shape future webinars. After the webinar, if you have any questions that have not been answered, you can email info@biomedix.com. At this time, I would like to introduce Dr. Michael Brody.
Thank you very much, and it's a pleasure to be here this evening. Before I start with the webinar, an interesting piece of news came out today. For those of you who are testing or have tested for meaningful use in 2011, you just got an extra year at Stage 1. Department of Health and Human Services Secretary Catherine Sebelius announced today that Stage 2 of meaningful use will not kick in until 2014. So those of you who have tested this year can stay at Stage 1 for 2011, 2012, and 2013, and your life just got a little bit easier. And that also means that nobody has to worry about Stage 2 of meaningful use until 2014. So that's a nice little bonus that HHS gave us, simply because the government is not ready for Stage 2. Not because any of the software vendors or we're not, but the government actually is not ready, so they're pushing it back for a year. Now let's get back down to the meat of today's meeting, or today's webinar. We've had 2 previous webinars where we talked about, there we go. We've had 2 previous webinars. Come on, behave. Is this the second slide? Yeah. Okay, we've had 2 previous webinars where we focused on the administrative and the physical measures associated with the HIPAA security rule. The HIPAA security rule has 3 parts: technical measures, administrative measures, and physical measures. And today we're going to be talking about the technical measures associated with the HIPAA security rule. From your perspective, the technical measures are the easiest measures to deal with, because most of the technical measures are actually going to be dealt with within the TrackNet software for you. There are some things you have to do, but the hardest part of meeting this has already been dealt with by BioMedix by building these features into TrackNet. If you remember from the physical and administrative measures, there's very little in terms of physical and administrative the software can do, but it really has been designed very, very well to support you for the technical measures of the HIPAA security rule. Nonetheless, even though it's done for you for the most part, you do need to understand what the technical measures are and how they work and what your responsibilities are in using the software. Now, the first thing with technical measures is controlling access to your systems. So you need to make sure that people who are using your software can only utilize the features that they have to utilize for their job description. For example, someone who does billing really should not be looking at the patient's charts or medical notes. Someone who is a secretary may only be dealing with certain aspects. Within TrackNet, there's a way to set permissions. It's a very, very well-designed system, so you can actually go in and configure it in order to control the access to the systems. In addition, what you have to do, which is outside of the software, is you have to track who you're giving access to and what level of access they're given. TrackNet has audit trail that keeps track of what everybody is doing, but nonetheless, whenever you change somebody's permissions and what they have access to, you have to keep track of it and justify why you've given them more or less access. The next thing that's required, and this is something that you have to make sure you do, is make sure that everybody in your practice has their own username and password. For TrackNet, that's easy. You simply set up everyone with their own account. What you have to do is when you set up the accounts on your computers, they also have to have their own username and password on the computer. So there cannot be a shared password to log onto the computer. When somebody finishes with the computer, they need to log off TrackNet and log off the computer. That way someone else can log onto the computer and log on to TrackNet. The reason for this is each person is responsible, and they are very responsible for what happens when their account is in use. So when you're logged into the computer, you're responsible for what's done on your account. If you walk away from the computer and somebody else sits down and your account is still there, as far as the computer knows and as far as all of the audit log knows, it's still you at the computer. So it's very important that everybody have their own account and you log off the computer when you walk away from it. Do not allow anyone to use the computer under your account. The next thing, which is built into TrackNet, is emergency access. Emergency access basically means that what happens if someone needs information from the computer and a privileged user is not around. The term for this is break the glass, and a break the glass feature is built into TrackNet, and it is available so that way if you need to get information from there, you can get it, especially if you're away from the office and somebody who's not privileged needs to get information for the health of a patient. It can be done. When this is done, it is tracked, and you do get notifications, but this is all built into TrackNet, and this is an available feature that is in there. Another feature, and this should be set up especially if you're using a domain control with Windows, it's very easy to set up, but automatic log off. You want to make sure that if someone is sitting at the computer and walks away, and they walk away and they're gone for more than a certain amount of time, they're automatically logged off. One of the best ways to deal with this is actually to go into the Windows settings and set up the screensaver and have the screensaver automatically kick in after a certain amount of time of inactivity. Then have the screensaver set up so that way when someone sits back down, they actually have to log back into the computer. This is built right into the operating system, and you should have this configured. If you don't have it configured, you can go into your control panel, your settings, display, screensaver, and set it up so that the screensaver kicks in after a certain amount of inactivity, and click the button requiring login after the screensaver is activated. Now, automatic lockout is how your system prevents break-ins. The most common way for someone to break in is to write an automated script if they know someone's username and simply keep hammering at the computer with various passwords until they find the correct password. There is an automatic lockout feature. This automatic lockout feature works whereas if someone tries to log in more than a set number of times with a single username and fails more than that many times, their account automatically gets disabled. An administrator needs to go in and re-enable the account. Once again, this is all handled by the software. You really don't have to worry about it. You just have to understand how it works, and if someone's account gets locked out, then you have a security incident, and you have to log it and find out why did their account get locked out. Did they forget their password? Did someone try to break into their account? If you approach them and they forgot their password, it's not really a security incident. It's simply they forgot their password. If they say they didn't forget their password, it means someone tried to break into their account, and now you have a security incident that you have to investigate and figure out what is going on and why is somebody trying to break into the account. If you find that someone's account is being attacked, you want to go into their account and actually change their username. So not only does the person have to figure out their password, but they have to figure out the username once again in order to try a break-in. Next item under the technical measures is encryption. The question is, does your system support encryption? The answer for TrackNet is a definite yes. TrackNet supports encryption. Then when you develop your HIPAA manual, you have to determine what type of encryption and make sure that the encryption is enabled. So when you're doing your HIPAA security, all you have to do is go to the page where you log your encryption method, type in the encryption method that is utilized in TrackNet, and make sure that it's enabled in your system and you have met this measure. Once again, it's simply writing one thing down in your HIPAA manual. The next item under the technical measures is transmission security. Transmission security is using encryption when sending files back and forth from one computer to another. You must have this enabled, and by default, this is enabled in TrackNet. They've already dealt with this for you. All your data that you're transmitting is fully encrypted and is secure. Once again, you really don't have to think about it, but just be aware that your data, when you're transmitting it with TrackNet, is encrypted and is secure. Now, integrity control is making sure that the data in your system stays intact. TrackNet has all sorts of tools built into it to prevent corruption of data and to repair any possible problem. In addition, TrackNet has a tool known as a backup. Hopefully everyone is doing backups on a regular basis. The reason these backups are important is if something happens, if you have a power outage or a crash while you're writing to the disk, you could end up with a problem, and your backups will help you to recover from that problem. Everybody should be doing backups every single day. If you're not doing backups every single day, you are not following good policies and procedures. So TrackNet, through its error checking, has good integrity control, and through the ability to do backups and restore those backups, ensures that your data is secure, is safe, and is recoverable in case of a disaster. The next item that's required by technical measures are audit controls. The audit controls simply are who is doing what with your system and when. TrackNet has this built into it. There is an audit trail in TrackNet. With TrackNet, you can go in and you can look at the audit trail and you can find out who did what, who looked at which patient's records, and ensure that people are only doing things that are appropriate based upon their job description. Once again, a technical measure that must be implemented, and TrackNet has already done this for you. It is internal to the system. You don't even have to think about this. Now, as I said before, unlike the physical and administrative measures, and as you can tell from today's lecture, most of the technical measures are already built into TrackNet. It's all done for you. There may be some things you have to configure or may want to configure. You may want to set up how many times someone can try to log in before they get locked out. But for the most part, leave the defaults alone. It's all done for you. It's set up in the default distribution of TrackNet. Has very good technical security built into it. And if you ever have any questions or problems, you can contact TrackNet technical support, and they will help to make sure you understand what's going on. But from your perspective, the most important thing to know is that it's built in, it's already there. Another measure that's a technical measure is having contingency plans. Contingency plans are what do you do when your computers go down? When they go down for a short time, for an extended time. A major portion of your contingency plans are having backup computers and backup data. Now, having an offline laptop, which is a wonderful thing, a wonderful component of TrackNet, and having that up and running and available is a wonderful contingency plan, because that takes care of you in terms of having access to your data if your entire network goes down. It is one of the wonderful features of TrackNet. And hopefully everybody who is on this call has a laptop that they have set up each day in offline mode, so that way they have access to their data should their network go down, should the server crash, or should the office burn down and you lose access to all your data. Because data availability is a HIPAA requirement. And that laptop, that offline laptop, will make sure that no matter what happens, even if your office burns down, you have access to your data in case of an emergency or a disaster. The next item that is a technical requirement is having business associate agreements. A business associate agreement is the agreement that you have. It's a contract, and you must have this contract with everybody who you share patient data with a few exceptions. The exceptions are you do not need to have a business associate agreement with Gateway, who is your clearinghouse, because they are a covered entity. You do not have to have a business associate agreement with any of the laboratories that you send lab work to, such as Quest, LabCorp, or Baco. You do not have to have a business associate agreement with an insurance company such as Blue Cross Blue Shield, Aetna, or Oxford. These are all covered entities. You do have to have a business associate agreement with BioMedix. You have to have one with your orthotic lab. If you utilize a transcription service, you have to have a business associate agreement with them. Anybody who sees patient data, you have to have a business associate agreement with, unless they are a clearinghouse, a health insurance plan, or another provider that is going to bill the patient directly. So another provider that bills the patient directly would be another doctor or any of those labs I mentioned previously. So in conclusion, between these three webinars, we've gone over the administrative measures, the physical measures, and today the technical measures. Hopefully you've been on the other two webinars, and at this point you have a good understanding, or at least a feel, for what you have to do to be compliant with the HIPAA security rule. The HIPAA security rule is very important because A, it's the law, and B, it is meaningful use measure number 15. You must be compliant with meaningful use measure number 15 and have a good HIPAA security plan in place in your office in order to receive the incentive money from the federal government. Now, as podiatrists, it's extremely important that we have this. The reason it's extremely important is if you've been following the news and looking at what's going on, you'll notice that podiatry as a profession is far ahead of the curve in adopting electronic medical records, and percentage-wise, more podiatrists have achieved meaningful use and received an incentive check than any other profession out there. This is a great thing, and this is a terrible thing. It's great because it means that we are aggressive, we are on the ball, and we are actively engaging in adopting electronic health records. The problem is, what causes an audit? An audit is caused by a statistical outlier. We as a profession are now a statistical outlier. HHS has already started sending out teams to audit practices to make sure that they have met meaningful use if they claim they have. So if you have attested for meaningful use and you have not done a risk analysis and made sure your administrative, physical, and technical measures are in place and you get audited, you are going to have to give that money back. So if you haven't done so yet, please go through the process, do your risk analysis, take care of all these things, so that way you have a good HIPAA manual in your office, and that way if you're audited, you will pass the audit, because all the other measures of meaningful use are based upon the report you got from TrackNet when you attested, and all you had to do is print that out, and that's your proof. So please, in addition to that, make sure you have a good HIPAA security plan available in your office in case of an audit, because right now, as far as audit goes, podiatry does have a target painted on its back. Now I'd like to open it up to questions. If you have any questions, there is a question box on the right-hand side of the screen. If you minimized it, there's a little orange arrow that allows you to maximize it. Go to the question box and type in your questions, and we will answer everybody's questions. Your questions do not have to be limited to the technical measures. If you have questions on any physical or administrative measures, I'll be happy to answer those today also. Okay, just give me a second to open it up. I see some questions here. Okay, Regina is asking, how do you get a HIPAA security policy and procedure manual to satisfy meaningful use rule number 15? Actually, up to date, I have helped over 200 podiatrists put a manual together, and you can send me an email. My email address is mbrody@cmeonline.com. Send me an email, and I'll give you the instructions on how to get set up with a HIPAA security manual to meet meaningful use number 15. Denise is asking, we have satellite offices that log on remotely. As long as remote access is password protected, are we in compliance? No, password protection is not enough to make sure you are in compliance. you must make sure that your data pipe, your connection, is encrypted. And with TrackNet, if you're using TrackNet and you've got it set up properly, it is encrypted. But make sure it is. Talk to your IT department, because if you're connecting over an open pipe and then using remote terminal services, it may not be. So make sure it is encrypted. A password is not enough. David is asking if we missed the first 2 webinars, are they on the BioMedix website? Yes, David, the first 2 webinars are available on the BioMedix website. And if you go in and, Melody, can you tell people where in the BioMedix website to look, since I haven't been on the website in a little while?
Yes, you can actually find the HIPAA webinars on the TrackNet PM or TrackNet PM DPM edition pages under View Latest Webinars. And if you have any other questions with viewing webinars or how to find them, you can email info@biomedix.com as well.
Okay, and Kathy is also asking about the webinars. So Kathy, there was the answer to your question. Can I please reiterate who you need to have a business associate agreement with? You need to have a business associate agreement with anybody who you share patient information with. The exceptions are, you do not need a business associate agreement with Gateway Clearinghouse. You do not need a business associate agreement with any health insurance plans, and you do not need a business associate agreement with any labs like LabCorp or Quest, because they bill the patients directly. You also do not need a business associate agreement with any doctors who you are referring patients to, because once again, they are doctors, they are covered entities, so you don't need a business associate agreement. Okay, and someone is asking me to repeat the email address, and the email address once again is mbrody, M-B-R-O-D-Y, at cmeonline.com. Now, Alan is asking, what about surgical reps whose implants we use? That would depend, Alan. If the surgical reps whose implants you use are receiving patient information, then yes. So, for example, when I have a patient come in who's getting a VAC from KCI, I do have a business associate agreement with KCI. If you're using implants and the patient's information is being given to the company, such as Great Toe Implants, then yes, you have to have a business associate agreement with the companies making those surgical implants. Okay. Are there any other questions for tonight? Okay. What would make email secure? This is from Carol. To have secure email, you have to have a secure email client on both ends of the world. Eventually, that will be available and regularly available to both you and to patients. Unfortunately, at this point in time, you have to make sure that not only is the email secure on your end, but it's secure on the receiving end. And even if you set up secure email on your end, you have no guarantee it's secure on the receiving end, so you really should not use email for sending patient information back and forth, because you cannot ensure it's secure from end to end. Kathy is asking if there is a standard form for business associate agreements. Yes, there is, and if you send me an email, I'll be glad to send you some standard forms for business associate agreements. There are a number of them out there that I can be happy to send you. Okay, are there any more questions? Okay, if you have not viewed the physical and the administrative measure webinars yet, I encourage you to do so. I encourage you to review them on a regular basis, at least once every 6 months, because you want to make sure you stay up on this. HIPAA is not a program where you sit down, get a manual, put it on the shelf, and you're set. HIPAA is something that is a moving target, because security in the world of computers is always changing. There are things out there that change in terms of hardware, in terms of software, and you need to make sure you constantly stay up to date. It's almost like staying up to date with your CME credits. You have to take courses, you have to keep up to date, you have to keep track of what's going on. Your manual in your office is a living document. You actually use it not only to read to know what to do, but to log your activities and your compliance with HIPAA. So if the HIPAA manual is sitting on the shelf and you're not pulling it down and logging what you're doing, that HIPAA manual is already out of date. Lloyd is asking about fax requirements. Faxes are considered paper documents. When you're talking about HIPAA security, the HIPAA security rule only applies to electronic data. A fax starts as paper and ends as paper, so it's not considered an electronic document, and you can send faxes back and forth between doctors and other entities without worrying about breaking the HIPAA security rule. The exception is if you are utilizing a fax server and the fax is being stored digitally, then the faxes become part of the HIPAA security rule, and you have to make sure they are properly protected. But if it's a paper fax machine, it is outside the realm of the HIPAA security rule. Does our IT person need to sign a specific form that shows that he has done our security risk analysis? No, the IT person does not need to sign a form to say he's done the security risk analysis, but he does have to actually put his security risk analysis on paper. Now, once again, remember, the IT person really is only going to be expert in the technical aspects of HIPAA security. The physical aspects and the administrative aspects of HIPAA security are outside the realm and the skills of your IT person. So if you have your IT person do a risk analysis, all he can do is an IT or his risk analysis or a technical risk analysis. You still have to do the administrative and the physical in order to be HIPAA compliant. Okay, do we have any more questions today? Okay, Melody, I don't see any more. So I believe we're set for this evening.
I just want to say thank you to Dr. Brody and to all the attendees who joined us for Understanding HIPAA Compliance, Technical Security. For more information about BioMedix or our products, please visit biomedix.com, call 877-854-0014, or email info@biomedix.com. Join us for our next webinar, Meaningful Use Best Practices. Are you participating in incentive programs on Wednesday, December 14th, with Dr. Brody and Dr. John Juliana, followed by How to Effectively Market Your In-Office Vascular Testing Device on Thursday, December 15th, with Marketing Communications Manager at BioMedix, Lindsay Tenzing. To register, visit the events page at biomedix.com and click on the webinar link. For more information on upcoming webinars and trade shows, visit the events page at biomedix.com. Please remember to fill out the short survey. Your feedback is appreciated. Thank you. We are adjourned.